Hello, everyone. I hope everybody had a fabulous holiday. I know that I did. I had a lot of opportunity to get away and take a little bit of a break, but also I spent a lot of my time actually working on my new book. And I am going to be pitching that to publishers here in about a week and a half. I have hours and hours of work to do before then. But I was just talking with my book agent this morning, and we were talking about some things that I thought was really it would be interesting to share with you. I talk a lot about root cause, and that we need to really understand root cause to be able to get to a solution for whatever we're suffering from, whatever we want a solution or an answer to. And we brought up an interesting example that you may not understand. And she said, "You're such a nerd to know this kind of stuff." But I thought, well, it's just what I like to do. I like to study. I like to learn root cause. One of the things that she really cautions me about often is said, make sure that I'm meeting all of you where you are, that I'm not making you feel like you should feel guilty for some of the choices you're making from a health standpoint. We were talking about energy drinks, for example. And the book that I'm writing actually is going to be all about energy and how do you literally increase your cellular energy, making sure that every single cell is functioning better and that every single cell has what it needs to perform in a way that allows you to live well. So as we were talking about this, I was talking about energy drinks. And it's funny, I just learned that the energy drink business is enormous, that there are millions of cans of energy drinks that are produced every single day. Why is that? Because we all want more of what it delivers, more of this energy. And my goal is to not make you feel bad for drinking that energy drink. It's to say, let me give you some other ideas, and eventually you might not even need it. So what are some of the ideas that you can do? Well, this is an interesting little known fact that there are thousands of lightning strikes that hit the earth every single day. Think about that. All over the earth, there's thunderstorms going on somewhere, and there's lightning strikes that hit the earth. Well, those lightning strikes are full of electrons. That's what Benjamin Franklin did when he had this kite and a key, and he actually caught, basically the electrons in a jar and saw that this electricity or these literal electrons came from that lightning. Well, those lightning strikes feed electrons to the soil. That soil then is a fabulous donor or donates those electrons, can donate those electrons to us. How do we get them? By touching the soil. And there are some really cool products nowadays. You can get earthing shoes, you can get earthing sheets and earthing mats, all sorts of really cool things in order to be more in contact with the earth and get these actual electrons. Why do we need electrons? Well, that's exactly like plugging your phone in to an outlet. How do we plug our body in? We have to get more electrons. We have to plug our body in and get more power, more electricity. Well, the earth is a really great source of it. So I hope that I always convey that if you're drinking the energy drink, I get it. I see why you're doing it. But I'm hopeful that I can share some ideas that eventually you don't have to have the energy drink or the coffee to get out of bed in the morning or whatever it might be, that you can also have energy. So let's tie that into dentistry a little bit. I had a woman yesterday, and I think that her story is a really good example. She has been on a CPAP for 7 years. So if you don't know what a CPAP is, a lot of people know what a CPAP is today, but it's a forced oxygen system. So it basically blows oxygen into your nose or mouth or both because you're not able to get enough oxygen, and you end up having something called sleep apnea. Well, this woman had been on a CPAP for 7 years. She hated it. She hated sleeping with it. If you've ever seen one, it's noisy. Your partner's listening to it as well. It goes on your face. It kind of straps on. Lots of issues. And she just wanted an answer. She wanted to know why she was having these issues and what she could do about it. So what we did is took a CT scan, and that cone beam CT scan showed that her airway, or the tube she breathes through, is super skinny. So the volume of the tube, and when I'm talking about your airway, I'm talking about literally the esophagus, or the trachea right here. Sorry, the trachea that goes down. It's the tube that the air goes from your nose and mouth down to the lungs. Now that tube is flexible. So it can be pushed on from the front. It can be pushed on from the back. It can be pushed on from both directions. What pushes on it from the front? All the structures in your mouth. So that might be the tissue at the back of your throat. When you say, ah, and you look back there, it might be the uvula, the soft palate, the tonsils back there, the tongue. All of these tissues can actually be swollen or can be too big or not. The mouth can be too small to house them. So they actually have to go back against that airway, against that tube. The other thing that can happen is the neck actually can push on the tube from the backside and can squish it up. Well, what happened with her, and she had about half the size of the tube that she should. And she said, well, why? And this is why she was so dissatisfied with the CPAP. She was having oxygen forced through her mouth and nose at night, but it still had to go through this teeny tiny cocktail straw to get down to her lungs. She said she struggled when she played pickleball. She loves to play pickleball, and she couldn't play pickleball very well because she wasn't able to get enough oxygen. I said, it's because your tube isn't big enough. There's too many things pushing their way into the tube. Why? Well, one thing we found is she had some residual infection in her wisdom tooth area. That residual infection was causing swelling in this back area and causing those tissues to be swollen and into her airway. So she couldn't breathe as well. So we're going to clean up that wisdom tooth, that infection in the wisdom tooth area. We're literally going to go back into that area, into that spot, going to disinfect it, scrub it out, disinfect it with ozone, and then fill it up with her own stem cells. We have a specialized procedure where we do a small blood draw. We pull out the stem cells out of her own blood and we put it back into that area, which tells the area to heal and to grow bone. So we're going to do that in that area. That's going to be step number one. The second thing we're going to do is we're going to shrink up the tissue way in the back of the throat. Now that she's been wearing the CPAP for so long, it's actually caught that tissue in this airflow and stretched it out like a big, stretchy rubber band. So now we have a laser procedure that can just shrink the tissue in the back of the throat. The third thing we're going to do is we're actually going to make more room in her mouth so that her tongue and all the tissue that goes in the back can actually come forward. So we're going to use clear aligners like Invisalign, if you know what Invisalign is, and we're actually going to make more room for everything to function. At the end of these things, she's going to hopefully be able to get rid of the CPAP. Now, she was so excited about this. Her husband said, when can we start? Can we start like tomorrow? You know, they were so excited about this. And then I went to do my note. And as I was talking my note, I transcribed my note. As I was talking it, I was saying she has had a CPAP for 7 years. And then a little later in the note, I said, and she's had ringing in her ears, really bad ringing in her ears for about 7 years. And all of a sudden I stopped and I went back into the room and I said, wait a minute, I just thought of something. The numbers line up. You've had ringing in your ears the same number of years that you've been wearing the CPAP. Well, what the CPAP does is it hooks on the back of your head and puts pressure on the front, on everything here on the jaw. It was pushing the jaw back into the ear canal and causing ringing. I think once she's off the CPAP, the ringing is going to improve exponentially as well. This is the cool part about finding root cause. You find the root cause, the underlying issue, which is too small of an airway, too small of a tube. And then you figure out all the things we can do to make that root cause go away. All of a sudden, the treatment that she's having, which is the CPAP, goes away as well. And she's able to sleep and breathe and feel great again without anything extra. So that's really the whole point of root cause. And I love this. All right, I've got some questions coming in. I would like to kind of tell you a topic before we get questions coming in, but let's hit your questions now. What is my protocol for before and after cavitation surgery? So first of all, what is cavitation surgery? I actually don't love that word, and I often will say that, but people know what I mean, and I know what you mean if you say cavitation. So that's just fine to say it. But really all it is it's an area in the jawbone that didn't heal after a tooth was removed. How can this happen, first of all? Well, it happens because of a few different reasons. Either there wasn't enough nutrients in the system to grow the bone. There was something left behind. A lot of times it's a ligament that's left behind that doesn't allow the bone to grow. Multiple different reasons. Sometimes it's even trauma to the area, and sometimes it's even anesthetic that's used. Some of the dental anesthetics we use have epinephrine in them. The reason we put epinephrine in them is because it makes it so that the blood flow slows to the area, so the anesthetic lasts longer. Well, blood flow slowing to the area also means bone growth slows to the area. So it can cause issues that way as well. So what do? We need to make sure that you're going to be able to grow bone properly after. So we super supplement you before and we super supplement you after. What does that mean? Well, your body requires a certain level of nutrients to be able to just survive and to be able to stay healthy, maintain health. But once you have a surgery or something like that, you're going to need an added layer to not just maintain, but also to get you to that healing zone. So we add all sorts of minerals and nutrients. So it's a broad spectrum of a bunch of things, a lot of vitamin D3 and K2 especially, and then a mineral that we call it our tooth and bone formula. It's a combination of bone growth, very specific bone growth minerals. We also added omega-3. And why do we add that omega fatty acid? Because it is good for nerves. And I want you to basically have no pain after this, to have a very easy healing process. And that omega-3 is going to facilitate that nerve pain will go away and everything's going to feel a lot better. Those are the big ones. And then after we do the same thing. We just want to super supplement you and keep you healthy after. Just lost that one just went away. Can you get just lost a tooth to tooth decay? Can you please guide me to the steps to take? I guess the question is, what steps are you wanting to know? Are you wanting to know how to avoid tooth decay in the future, or do you want to know what to do once the tooth is gone now? If you want to know now that the tooth is gone, that's going to take about 3 months for that bone to grow where the tooth used to be, enough bone to be able to place a dental implant. Sometimes there's not enough bone even then, and there has to be some sort of a bone graft at that point. That will have to be determined on x-rays to see how much bone is there. Then we place ceramic dental implants. That takes about 4 months to heal. And what that's going to do is that bone is actually going to grow to that implant and secure it in place. Once that implant, which is the root portion, you actually don't see anything above the gum. Once the root portion is secure in the jawbone, then we put the chewing portion on the top. So that's the steps as far as what do we do to replace a tooth after losing it to decay. Can you get a cavitation under a root canal tooth? Good question. The answer is yes and no. It depends on your definition of cavitation. Typically, a cavitation is an area that a tooth has been removed or a tooth never grew. It gets a little detailed, but sometimes where a tooth never grew can also create a cavitation. But it's usually where there is no longer a tooth. What you get at the end of a root canal is a new abscess. So it's actually growth of bacteria, because root canals can never be completely sealed. So it's growth of bacteria that have found the dead tissue that's still in that tooth. And those bacteria then eat away the bone at the end of the tooth. So it's more of an abscess than a cavitation. It's an abscess or a growth of bacteria that have eaten away bone. So it's a little bit about the definition. But is there a problem at the end of root canals? Often. Okay. I can't see this one. I had misdiagnosis cavitation. There was a sac left behind when it became an abscess. Now I have a recurrent abscess requiring antibiotics and debridement. Infectious disease doctor believes I may have an osteomyelitis. Wow, this is really hard. The thing I'm going to recommend for you is hyperbaric oxygen. Hyperbaric oxygen is the thing that will add so much oxygen to the system that osteomyelitis will, if that's truly what you have, is an osteomyelitis. So I would look into hyperbaric oxygen, and you're going to do something called dives, and you may need to take up to 60 dives to really oxygenate that area enough to let it heal properly. But you're going to also need to super supplement yourself. So vitamin D3, vitamin K2, and our tooth and bone formula to grow bone back in that spot. I have a constant ache in the back of my mouth. A constant acid in the back of my mouth. I'm at a loss of what to do. I know it's bad for your teeth and esophagus. Great question. So usually this is due to actually too little stomach acid, interestingly enough. So you're going to go and want to do the baking soda test. If you don't know where that's at, we can put that on here. We can put a link up on here as far as for the baking soda test. You're going to want to find out, do you have too little acid or do you have too much stomach acid? Because there are very different fixes for both of those things. Go check out my website too, livingwellwithdrmichelle.com, and you're going to be able to find a gut health guide. It's going to walk you through the baking soda test, and then it's going to walk you through the steps based on your findings with the test. So go check that out. I'm going to do these real quick, and then I'm going to jump over to our ones from Instagram. Can I have a temporary implant while allowing my tooth to grow? Yes and no. You can do a temporary removable tooth that goes in and out, and the best one is going to be on a removable retainer like an Invisalign retainer. So it can go in. It looks like it has a tooth. You can't chew with it, unfortunately, is the one detriment to that. But it is for smiling. So I typically call it a smiler. It's a smiler tooth. It's for smiling, and you do not want that to put a lot of pressure on the gum, because then the implant won't integrate very well. So that's the key. That's the difficult thing. But yes, absolutely. You can wear a retainer with a tooth in it so nobody knows you're missing a tooth. Do you use orthotox to determine if a root canal is infected? So I don't, because I can use a CT scan to see visually if there has been bone loss around the end of the root. That's my diagnostic tool, because I see it so readily and easily on a CT scan. I will tell you, I've never removed a root canal tooth yet that has not had infection at the end of the root. It's just the way it is, because there is dead tissue left in the tooth. Bacteria always find it. Does the bacteria spread and create a huge hole in the bone? Sometimes not, but there's always some residual bacteria at the end of that. All right, we're going to jump onto some questions over here. I have a dentist that states they're holistic. How can I make sure they do what you do? Any good questions to ask? Yes, let's actually go through some of these questions. So you're going to want to ask their stance on mercury. Are you mercury safe, not just mercury free. So mercury safe means when removing a mercury filling, they are going to use a whole bunch of extra protocols and precautions to keep you and them safe. Number 2, what is your stance on fluoride? If they're still using fluoride, then they're really probably not exactly what you're looking for. Number 3, tell us about your prevention program. What are you going to do to help me prevent tooth decay, help me prevent gum disease? And they should have some answers for you in these areas. Those are big 3s. Depending on what other care you need, you can talk about, do you have products that you recommend for, for healing cavities? And only some cavities can be healed. Only the ones that are surface layer can't. The ones that are deeper can't. They need to be filled. I'm absolutely in agreement with that, because you're going to have a dentist probably push back. Well, you can't heal cavities. Make sure you specify. I'm talking about the ones on the very surface. Are there ways to do that? Do they use ozone? Ozone is phenomenal for gum disease, for cavities, for sinus infections, for a whole bunch of things. So really, if they're truly a holistic practice, they should be having ozone. So these are some questions you can start to ask. Thoughts on expander just on the top. So it's interesting, because an expander, what is the purpose for that? Well, oftentimes, just yesterday I had a patient ask, why are mouths so small? Why can nobody fit their wisdom teeth anymore? Why does everybody need braces? Why are everybody's teeth crooked? Well, there's a couple of things that people are guessing, surmising, that might be happening. Number 1 is the nutrition levels in our food is actually dropping. We're being called the most overfed, undernourished society ever. What does that mean? Well, it means that the way our food is farmed, commercial farming, doesn't actually add nutrients to the plants. It adds artificial fertilizers to the plant, which allows them to grow, but it doesn't allow them to have what you need. There's only 3 main components in those artificial fertilizers. Well, you need a lot more than that, but they're not feeding the soil. And if the soil isn't fed, then the soil can't feed the plant, and the plant can't feed you. So we often have food that just doesn't have a lot in it. It doesn't have a lot in it, and we're undernourished. So this is why we do need to be very conscientious about where we're getting nourishment from and what our food actually has in it. It's a whole nother talk all on its own. But when we're undernourished, the first bone that actually is affected by malnutrition is the top jaw. Isn't that interesting? I learned because my son that I adopted came with an incredibly small upper jaw, and he was very malnourished. So this was a problem for him for sure. So malnourishment is a problem. And the other problem is a lot of the oral habits that we're using as children. So pacifiers, bottles, sippy cups, all those kinds of things are actually changing the structure of mouths. 100 years ago, 200 years ago, people had plenty of room for all of their teeth. For wisdom teeth, they didn't have crooked teeth, but we're seeing it so much today. So this is the reason for the need for an expander. What an expander does is actually expands that upper jaw and makes more room for the teeth, for the tongue, for the tissue at the back of the throat, for all of those things. When you make more room like that, everything's able to come forward and function the way it should. Now, do you need an expander on the lower? No, here's why. Because the tongue is actually an incredibly strong muscle. And when you've expanded the top and bottom teeth fit inside each other like this. So when you expand the top, you've now allowed room for the tongue to expand the lower, and you often get some residual expansion. Usually it's followed by some sort of braces as well. So those two things go together, but that's why the expander only happens on the top. I just called your office and the first appointment available was in September. I'm so sorry. I'm interviewing 2 doctors today. We're working on it. We're trying to get people in sooner, but make sure you get on the quick call list. Literally, I saw a patient yesterday who'd called the day before. So sometimes we have patients who are traveling from out of town. Their travel schedules change, whatever it might be. And there are changes. So make sure you get the quick call list. Make sure you're probably going to get in a lot sooner than you originally scheduled. Get on the schedule now so that you're on our lists. And then, like I said, we are working on it. We're working on training doctors. We're working on bringing them on board because it's my biggest pet peeve too. What options for wisdom teeth if the dentist suggests to have them removed, if they're causing some pain? So here's the key on wisdom teeth. If there is room for them to fit in the mouth, I love for them to stay, especially if you can keep them clean. If there's not room for them to fit in the mouth, and if you can't keep them clean, then I recommend that they be removed. So that is basically my guideline. And what happens when they're removed, we make sure that we remove all the ligament around that tooth. We clean it very, very thoroughly, make sure there's no tissue left in there. And then we actually place those stem cells. What can you ask for when you're asking a dentist? You can ask for PRF. It's called platelet-rich fibrin. And PRF, just remember that PRF, you're asking for PRF in that site. Because if you say stem cells, they're probably going to say, we don't do that. If they do PRF, they are doing stem cells, but it's not the same as a doctor may do in your knee or something else. So just ask for PRF. That's what I want when I'm having my wisdom teeth removed. Is a cone beam CT scan the same as a 3D x-ray? Yes. A biodentist told you can see cavitations with a 3D x-ray. It's the same thing. Different name for the same thing. Is it okay to use your toothpaste with a dry toothbrush, or does it need to be wet? You can use it with a dry toothbrush. You just may not be able to pick up much on that dry toothbrush. That's the key for that wet. And I don't do it very wet. It's not dripping at all. It's just moist, just enough to be able to basically grab the dry tooth powder and bring it to your mouth. If you can do it with a dry toothbrush, go for it. Are root canals dangerous? Well, that's a loaded question. Root canals cannot be thoroughly cleaned. It's impossible. You can ask any dentist, are there little tubes down the side that still have tissue in them when we're done with the root canal? Yes, there are. The problem is that then impacts your immune system. So your immune system has to work dead tissue always attract bugs. So your immune system has to work to keep those bugs at bay. Well, what does that do to your immune system? Sometimes it confuses it. Sometimes it becomes so confused it starts to fight itself, which is autoimmune disease. Sometimes it will lead to a weakness in certain energy channels in the body. When I'm talking energy channels, I'm not talking about we're meditating now and tapping into energy. That's not the kind of energy I'm talking about. I'm talking about literal electron flow. There are electrons that flow through our body. We know because our heart beats and we can measure it on an EKG. That heartbeat is the electrons flowing through the system. Well, those electrons flow through every single organ system because our organs are alive. They're alive. They continue to function. So each organ system is actually connected to a tooth. A tooth is alive as well. And this is the problem with the root canal. It's no longer alive. And so it shorts the entire circuit, and each tooth is connected with another organ on a circuit. So for example, a tooth right here is connected to the breast. And there are so many people I know that have a root canal in this tooth and have breast cancer. Can I correlate the two and say that one caused the other? Never. I'll never say that. But I will say that root canal did compromise your immune system and led to a weakness in that area. Did that lead to the cancer? I can't tell you that. But you can make your own assumptions and your own thought processes based on that. So root canals harbor hidden infection. They're dead organs. Those two things can lead to other problems in the rest of your body. So I'm not going to answer, is it dangerous or not? I'm going to let you come to your own conclusion. What's the best toothpaste? My tooth powder. I wouldn't just say it if it was mine, if it wasn't actually amazing. It actually is amazing. And you can believe there's tens of thousands of people who use this product and love it. There's many different, we have 4 different versions: a regular remineralizing formula, a whitening formula, sensitive formula, and then a remineralizing that is a citrus flavor that we call our kids formula because kids like it, but adults can use it too. Can a sinus lift cause any problems on a long-term basis? What a sinus lift is when you have an area that is not tall enough, there's not enough bone to actually place a dental implant on the top. So you've lost a back tooth on the top. There's not enough bone there to place a dental implant in. We lift the bottom of the sinus up to allow for more bone there for dental implant. It actually usually allows the sinuses to clear a little bit better because when there's low spots in the sinus, it's hard for that sinus to clear the junk out. So it actually allows the sinus it allows the sinus to clear itself a little bit better. So as long as that sinus lift was done well, it actually can be beneficial for you over the long run. My son is 8 and his teeth still haven't fallen out. Is there a reason for this? Also, his lower front teeth are beginning to grow in, so it's becoming an issue. Well, most likely if the teeth are coming in and they're not pushing the other teeth out, what's happening is his jaws are too small. The teeth are coming in on the inside of where they should be coming in. So 8 years old, sometimes their teeth still are in. So that's not a concern. You don't have to worry about that. But if they're starting to come in odd places, that means the mouth's too small. So I would suggest visiting an orthodontist that will do some interceptive orthodontics. Interceptive means we're intercepting their growth pattern and we're allowing it to grow or helping it to grow before a lot of crowding happens. So expansion may be necessary at this point. What if you burp just from drinking the baking soda mixture? All right, that's a hyperactive system. And it could indicate that, because what's supposed to happen in the baking soda test is you're supposed to burp within about 2 to 3 minutes after drinking a baking soda solution. That tells us that you have adequate stomach acid. If you burp immediately, it means your stomach is, hyperactive. It's throwing things out. So what I recommend for you is I would actually recommend starting to use Gut Soothe. What Gut Soothe is it's a natural product. It's diglycerated licorice, and it's going to soothe and rebuild the gut lining some, because that hyperactive stomach is going to be high acid, low acid. It's going to be all over the map. You want to soothe some things. I would also do our Gut Well product, which also rebuilds the gut lining. You're going to do all of that to try to soothe and calm everything down. Then retry the baking soda test after about 2 months of that. See what you find. What would you advise for someone who was exposed to mercury from a botched smart amalgam removal in 2020? I'm sorry, first of all, this is my life. I breathed in much of that mercury. What you're going to do is you're going to go to a functional doctor and you're going to find out, first of all, how much metal is in your system. Is there mercury there? And you're going to do what's called a mercury provocation test, which means you need to do something that's actually going to pull the mercury out before testing it. So make sure you're doing a provoked test. And they're pulling it out before they test it, see how much mercury is there, and then they can walk you through a mercury detox. Thoughts on Vivos. All right, so Vivos is an appliance that, Vivos is an appliance and a brand and a company. So it's actually a company that was owned by an Indian doctor named Dr. Singh. And Dr. Singh really revolutionized this concept of being able to use epigenetics to expand the top jaw. There's also some lower appliances, lower expanders you can wear as well. Well, that technology was purchased by Vivos. And so they have since taken that technology and put it into the hands of more doctors, which is a great concept. Here's what I know about Vivos from my own experience, that typically you're going to get better results with Vivos than you're going to get with clear expanders, with like an Invisalign. We use a company called Candid. With Candid clear aligner trays, you're going to get better results with Vivos here's the caveat, if you're able to wear it 16 to 18 hours a day. If you've ever looked at a Vivos appliance, you'll know that you will not be able to talk or eat with that appliance in. So if your work, if your life, if your everything allows for that, you can count your hours of sleep. But if you think that's 6 to 8, then you got about another 10 that you're going to have to wear it during your day. If you live a life that allows for the 16 to 18 hours of wear, it's going to give you the best results. If you live a life that does not allow for 16 to 18 hours of wear, it is not going to give the results that you are going to be able to get by using Candid, which is a clear aligner system, because you are going to wear those 23 hours a day, because you can wear those talking, you can wear those all those other times. So you're going to be able to get a better result with Candid if you can't wear Vivos 16 to 18 hours a day. Thoughts on tongue tie release for an adult without myofunctional therapy? Let's talk about this first of all. What is a tongue tie? Down here is where your tongue is connected. It's a muscle attachment to the bottom of the mouth. And if that tongue cannot come up and forward in a correct swallowing posture, it often falls down and back into the throat and gets in the way of breathing and airway. And you'll show up as fatigue, as snoring, as sleep apnea. So I love the concept of clipping that tongue tie. However, here's the problem. If you're an adult, you've been using that tongue in the way you've been using it for however many years old you are. So you don't know, your tongue has no muscle memory for actually doing the correct swallow pattern. So I do not recommend doing a tongue tie release if you're not going to do myofunctional therapy. Myofunctional therapy is the teaching of how to retrain the tongue to do what it needs to do. Your tongue will simply just be looser, but it won't know functionally what to do if you've not had the training. So those two things actually go hand in hand in my office. Orthodontist glued a metal rod in my mouth 5+ years ago, but glue keeps breaking and teeth are moving. Suggestions. This is a whole nother topic. So that is a retainer. It's called a fixed retainer. It's meant to retain your teeth where they are. If your teeth keep moving and if the glue keeps breaking, what's happening is your teeth don't want to stay there. I want you to think about this. Why are you holding teeth in a place that they don't want to stay in? Why don't they want to stay there? Most likely functionally, they don't function very well there. Either the tongue is pushing things out because the tongue has no room. The tooth, maybe the way that the teeth fit together, it's actually pushing a tooth this way or pushing a tooth this way. If the teeth are moving, the brace is finished in a very unstable position. So my recommendation is to see if you can get a stable spot that doesn't require retention. What does that mean? Well, that's a whole nother talk. But typically, if the teeth aren't moving, or if the teeth are moving, if they're not staying where they are, then functionally they are actually not in the right place. If you just want an easier answer, get a removable retainer, one that you can pop in at night. That's the easy answer. The harder answer is go back to the orthodontist and say, I need to find out why my teeth don't want to stay here. Where should they be instead? Let's figure this out functionally. Is it safe to have a root canal tooth removed during pregnancy? So this is a real gray area. The answer is if it's hurting. Because you are going to introduce a lot of infection to the system when you remove that tooth. And if it's not hurting, not causing pain, I would wait till the baby's born. What's the safest kind of retainer after braces? We just talked about that. My preference is no retainer, but I do like the clear removable retainers, just worn at nighttime and then slowly weaning off of that entirely. I have a broken molar and it is exposed to silver filling. Is this bad? Well, I don't love silver fillings at all. So if you have a broken molar, that's the first problem. I would recommend getting that filling taken out safely using the SMART protocol and then having that tooth fixed. Where am I located? Utah. Easiest question of the day. I'm in Utah, just south of Salt Lake. My sister works in the biggest dental research lab in USA. How do we get your work to India? I would love to do that. Just have her reach out to us. Have her reach out to livingwealthdrmichelle.com. There's some contact there, or on socials as well. Just DM us. Can you explain how many dentists will miss the infections you treat? Are these people not going to the dentist? How many dentists will miss the infections? So that's the first one. They miss the infections because they can't see them. They're not intentionally missing them. They can't see them. You cannot see these often on a traditional dental x-ray. That's why we use the cone beam CT scan. That's how we see them, is on the cone beam CT scan. So if you're not using that 3D x-ray, we simply can't see them. Frequently, we can't see them. Do we need, or should we ask for PRF for all extractions, not just wisdom teeth? Great question. The answer is yes. PRF should happen at every single extraction. What PRF is it's a fibrin matrix. So it's like this. It's kind of like a fabric. And what that does is it gives something for the bone to grow to. But in that fabric has growth factors and stem cells, and allows those growth factors to drip slowly over about 7 to 10 days instead of basically going and then washing out of that socket. So it allows a slow drip of growth factor, as well as a matrix to grow to, as well as your own stem cells that say grow bone, because that's what stem cells do. Wherever they're put, they initiate this, they stimulate the body to grow whatever should be there. So absolutely every single extraction. I already got that one. I have black specks coming out of my sinuses at times. Is it cavitation related? Also, when will your tooth powder be available for shipping to Europe? Thank you. We were shipping to Europe, and we ran into so many problems with customs and things being sent back and it costing like $50 for you to get it shipped there, that we paused that until we could learn a little bit. So we're working on that, but it was just too costly for you to be able to get it the way we were doing it. So we're learning and trying to get better. Black spots coming out of sinuses. So what I would recommend is doing fungal detox. My favorite thing to do is actually to use a neti pot with some colloidal silver in it. Not much, about a half teaspoon of colloidal silver in a neti pot of just water. You could also add a couple drops of tea tree oil. You're going to use that to rinse those sinuses. Usually it's a fungal infection that's happening with that. Can you leave your toothpaste on an area that has a small cavity to help heal it? I actually recommend that all the time. So what I do is I tell people, brush your teeth at night, and then you're going to use a little bit of that extra tooth powder. You're going to rub it right where it's sensitive or right where a cavity is, and then you're going to go to bed. Just let it stay on there. What's your user protocol when someone has TMJ? Can a cone beam x-ray be done to confirm this? That is the first step, is you're going to use a cone beam CT scan to see what's going on with the joint. I need to determine, is this bone? Is this muscle? So the only way to determine that is with a cone beam CT scan, because protocol and treatment is going to differ based on which it is. Is it bone or is it muscle? I have to find that first. Why do I have white spots in the front of my teeth? Is there anything I can do to change this? Typically, that's two things: either high fluoride levels when those teeth were developing, or high fevers when those teeth were developing. So either those things influence the development of the actual tooth bud itself and the enamel formation in those teeth. What can you do about it? Well, you can cover it up either with a filling or a veneer, a porcelain layer on the front. You can use the tooth powder or other whitening materials to hyper whiten the rest of the tooth so it blends in a little bit more. Basically, those are your two options. I found a TMJ specialist that has been doing custom-made neuromuscular appliances for years. He doesn't recommend a whole mouth orthotic. Is custom-made small orthotic risky? Lab-made ones are better. So if they're using a custom-made neuromuscular appliance, that's fabulous. We do use a full arch or full mouth neuromuscular appliance. That's the thing we use in our office as well. The smaller ones, are they risky? I don't know enough to be able to tell you. I wish I did, but we've only used just a full arch, typically on the bottom teeth when we do a neuromuscular appliance, so it can stabilize everything, front to back. I have a hole in my lower front gum, no pain, keeping it clean. What to do? Well, that's called a fenestration. What that means is you have no bone over the front of that tooth. You need to go visit a periodontist, which is a gum surgeon, to find out how can they heal that. All right, I'm going to go jump back to here, a couple questions. What could you ask the dentist to place in a cavity before doing a root canal? If you've been told you need a root canal, what we do instead is, if the tooth is still alive, we remove the deepest decay all the way down to where if we removed more, it's going to actually lead to exposing the nerve, which will then be the first step of a root canal. We don't want to do that. We remove the deepest decay down to that level. Then we use ozone to kill the rest of the bacteria in the area, and we fill right over top of it. So we actually save teeth, and we're successful in about 90% of the time where we're actually able to save teeth. People have been told they need a root canal. So you need to find somebody who has ozone to be able to do that. Where can I find information on which teeth goes with which organ? Look up tooth meridian system. It is fascinating. There's all sorts of stuff online. You'll see all sorts of charts online. Look up the tooth meridian system. What do you do if your tooth already has a root canal? Well, you're going to need to go get a CT scan and find out, are they infected? Is that tooth infected? Because it might be that we're going to remove that tooth. I tell people this all the time. And I had an interesting conversation. I think I'm going to wrap up with this. I had an interesting conversation with a patient yesterday. She was not happy with my recommendations. I told her that she was going to lose 4 teeth. She didn't like what I had to say. And I could tell, her body language, I could tell. She didn't like what I was going to say, what I was telling her. And I just stopped and I said, you know what? Tell me about that. She said, well, it's just not what I expected. I said, I understand exactly what you're saying. And there's a word that dentists sometimes use amongst each other. We don't typically use it with you. And it's herodontics. Herodontics means we have been taught to save teeth. As dentists, we've been taught to save teeth. That's our whole job, is to save teeth. And I think back to some of the things I did that I knew were not going to work. I mean, I knew they weren't going to work. I knew there was no way that filling was going to last in that tooth because it was so big. There was no way that tooth was going to last. They were going to break it. They were going to lose that tooth. Something was going to happen, but I did it anyway. Why did I do it? Because the dogma, the mantra that we are told is save every single tooth. And I looked her straight in the eye yesterday. I said, I will not do that to you. I could put a patch on every single tooth. She already had one. She had a tooth that had been broken off at the gum line completely. A dentist just glued the broken part to her next tooth over. I said, in what world is that going to last? She's 75 years old. And I said, how old do you want to be? Like, how old do you expect to get? Do you want to be 90? Well, when do you want that tooth to fall out again? When you're like, now let's fix it now, or do you want it when you're 88 and you can't get to my practice and it's infected and it's causing all sorts of health problems and your life is not as good as it could be until then? I don't want to do that. I will not do that. So I will not sugarcoat things. If you need to lose 4 teeth, I'm going to tell you, you need to lose 4 teeth to give you what you told me you want, which is better health, dentally and overall. It's not worth sacrificing your health for your teeth. It's not worth it. We can replace your teeth. I can't replace your health. It's not worth it. So herodontics are not worth it. A lot of times we do things in the name of saving your tooth that we know isn't going to last. It's not what you need. It's not what you're really wanting. Make sure it's something that is going to get you to a better place in the long run. Sometimes it's hard answers, like you're going to need to lose this root canal tooth. It's okay. I can replace it. We can replace it many different ways. It's okay. All right. Thank you so much. I love all the questions. We're going to keep doing this every single week. Jump on with us. We're going to just do rapid fire questions. And as much as I can answer on here, I will. All of you have a fabulous week, and we'll see you next week. Same time, same place.